Alcohol is a drug. Do not be fooled. It is classified as a depressant, which means that it slows down the nervous system. It also has many medicinal purposes, such as treating insomnia and anxiety. Other studies from universities such as Harvard say that drinking alcohol can lower your risk for cardiovascular disease, reduce your risk of death by 18%, prevent the common cold, and lower the chance of developing dementia and diabetes.
However, off the record, I would say the effects outweigh the risks. Behavioral effects such as slurred speech and drowsiness are very common after drinking alcohol. Not surprisingly, most crimes are associated with alcohol, almost 20%. This is excluding murder. 40% of murders are associated with alcohol, thus showing that alcohol does indeed increase aggressiveness. Although classified as a depressant, the amount consumed determines the effect. Most people drink to loosen up and get crazy after watching TV after work. However, if this said crazy person consumes more alcohol than their body can handle, they can experience the depressant effect. They will consequently feel stupid or lose coordination and control.
Short-term effects such as poor vision and sleep interruption are often seen, and you can see more listed to the right. Long-term physiological effects include anemia, coma, and death, with even more listed. The cause of alcoholism is still unknown. Alcohol dependency develops when you drink so much that chemical changes in the brain occur. These changes increase the pleasurable feelings you get when you drink alcohol, which makes you want to drink more often, even if it causes harm. Eventually, just like the other drugs of abuse, the pleasurable feelings associated with alcohol use go away, and a person with alcohol dependency will engage in drinking to prevent withdrawal symptoms, which can be quite unpleasant and even dangerous. These are just some statistics and graphs about drinking.
The National Institute on Alcohol Abuse and Alcoholism defines binge drinking as a pattern of drinking that brings blood alcohol concentration levels to 0.08 grams per deciliter. This typically occurs after 4 drinks for women and 5 drinks for men in about 2 hours. The Substance Abuse and Mental Health Services Administration defines binge drinking as drinking 5 or more alcoholic drinks on the same occasion on at least one day in the past 30 days.
About 90% of the alcohol consumed by youth under the age of 21 in the US is in the form of binge drinks. Many students come to college with an established drinking habit, and the college environment can exacerbate the problem. According to a national survey, almost 60% of college students ages 18 to 22 drank alcohol in the past month, and almost 2 of 3 of them engaged in binge drinking during that same time frame.